Hello everyone, and welcome to the Molar Academy. Today, we continue our medical emergency series by discussing a critical and highly relevant topic: diabetes and glycemic emergencies, something you will frequently encounter in dental practice. Let's begin with the bigger picture. According to the International Diabetes Federation, approximately 589 million adults between the ages of 20 and 79 are living with diabetes worldwide. That's roughly 1 in every 9 adults. So, as future clinicians, this is not optional knowledge. This is essential. So, what is diabetes mellitus? Diabetes mellitus is a chronic metabolic disease characterized by consistently high blood glucose levels. This condition can result from insulin deficiency, insulin resistance, or a combination of both. We'll understand this better as we go through the types. Before we jump into the specifics, let's first understand the crucial role of insulin in blood glucose regulation. When we eat food, there's an increase in blood glucose levels, which stimulates the beta cells in the pancreas to release insulin. Insulin performs two important functions. It stimulates the liver to convert glucose into glycogen for storage, and it facilitates the uptake of glucose into body cells. In simple terms, insulin allows glucose to enter the cells and be used for energy. Now, let's discuss the types of diabetes. Type 1, diabetes mellitus. It occurs when the body cannot produce enough insulin. Let's understand the pathophysiology. There is autoimmune destruction of the beta cells in the pancreas, which affects insulin production and leads to absolute insulin deficiency. As a result, glucose uptake by the cells is impaired, causing hypoglycemia. However, the cells are still lacking energy, prompting the body to seek alternative sources. As a result, the body starts to break down muscle and fat for energy. This fat breakdown leads to the production of ketone bodies, which can result in diabetic ketoacidosis. Now, let's talk about type 2 diabetes mellitus. This condition arises when the body becomes resistant to insulin. What happens here? When blood glucose levels increase, the pancreas releases insulin. However, the cellular uptake of glucose is hindered due to this resistance. Consequently, more insulin is released, a process known as compensatory hyperinsulinemia. This stage is often referred to as pre-diabetes. Over time, this chronic process leads to hypoplasia and hypertrophy of the pancreas, ultimately resulting in little to no insulin production. As a result, diabetes develops, leading to hypoglycemia. Let's review the common clinical features of both types of diabetes. You should always remember the classic 3 Ps: polyuria, frequent urination; polydipsia, excessive thirst; polyphagia, excessive hunger. In addition, unexplained weight loss, fatigue, blurred vision, delayed wound healing, recurrent infections, peripheral neuropathy, tingling in hands and feet. As dental professionals, this is where our role becomes very important. Common oral findings include periodontal disease, most significant; xerostomia, dry mouth; increased risk of dental caries; oral candidiasis; burning mouth syndrome; delayed wound healing; taste alterations; and importantly, fruity breath, which is associated with diabetic ketoacidosis, is most commonly seen in type 1 diabetes. If diabetes remains uncontrolled, chronic complications can develop, such as microvascular issues, retinopathy, nephropathy, neuropathy, cardiovascular disease, and diabetic ketoacidosis, which is particularly linked to type 1 diabetes. Now, in your dental practice, How do you effectively manage patients with diabetes? Here's a step-by-step guide. Before treatment, take a complete medical history and inquire about diabetes, past hypoglycemic episodes, medications, and any complications. Assess glycemic control, HbA1c if available. Monitor chairside blood glucose levels. Checking vital signs like blood pressure and pulse is also crucial. Schedule appointments for diabetic patients in the morning and ensure they have had something to eat prior. Always have an emergency kit prepared. During treatment, implement stress reduction protocols. Explain each step to the patient in detail. Keep appointments concise to minimize stress. Ensure adequate anesthesia and monitor for any signs of hypoglycemia throughout the treatment. After treatment, recheck vitals if necessary, reinforce medication compliance, and provide clear post-op instructions. Follow up with the patient to ensure their well-being. Now, let's focus on hypoglycemia, which is a significant concern. Hypoglycemia occurs when blood glucose levels fall below 70 milligrams per deciliter. This is the most common medical emergency in diabetic dental patients. Be mindful of these signs. Early signs, like hunger, anxiety, sweating, palpitations, tremors, and pale, cold skin. Late signs, like confusion, slurred speech, irritability, seizures, and loss of consciousness. If you ever encounter a patient experiencing hypoglycemia, stop treatment immediately and clear the instruments. Next, assess consciousness. If the patient is conscious, position them semi-supine or upright. Administer 15 to 20 grams of fast-acting carbohydrates such as glucose tablets, juice, or soda. After 15 minutes, check blood glucose levels again and repeat if it's still below 70 milligrams per deciliter. Once symptoms resolve, offer a more substantial snack, like a sandwich or biscuits, then postpone further dental treatment. If the patient is unconscious, call emergency services immediately, position them supine, maintain their airway, and administer 1 milligram of glucagon intramuscularly or give IV dextrose if trained. Provide oxygen if required and continuously monitor vital signs. Before we conclude, it's important to understand when not to treat a diabetic patient. As clinicians, knowing when to defer treatment is just as important as knowing how to manage. You should postpone elective dental procedures in the following situations. HbA1c greater than 8% indicates poor glycemic control. Blood glucose levels above 200 milligrams per deciliter at the time of appointment. Presence of an active infection that is not being managed. Signs and symptoms suggestive of diabetic ketoacidosis. Attempting elective treatment under these conditions can delay healing, increase risk of infection, precipitate a medical emergency. In such cases, the priority is medical stabilization, not dental treatment. On the next slide, you'll see a quick chart summarizing HbA1c levels and glycemic control, blood glucose ranges, and how they guide dental management decisions. This is a practical reference you can use in clinics to quickly assess whether to proceed, modify, or defer treatment. Understanding diabetes, recognizing hypoglycemia, and knowing when to proceed or when to defer treatment are essential skills for every dental professional. By applying these principles, we can ensure not only effective dental care, but also the safety and well-being of our patients. I hope this video helped you better understand this important topic and made you feel more confident in managing diabetic patients in your practice. Thank you for being part of the Molar Academy. If you found this helpful, don't forget to like, subscribe, and share so more students and professionals can benefit.